Good evening, everyone. My name is Ashley DePriest. I'm the president for the Southeast Chapter Society of Critical Care Medicine. Thank you all for joining us for our quarterly education meeting. We always like to start our meetings off with our mission and vision. The mission of the Southeast Chapter FCCM is to secure the highest quality care for all critically ill and injured patients in the Southeast region by providing educational and research opportunities, as well as promoting multi-professional collaboration. Our vision is for all critically ill and injured persons in the Southeast region to receive care from a present integrated team of dedicated trained intensivists and critical care specialists, as well as inspire new leaders and providers of critical care in the region. We're going to start tonight off with a few announcements. Information about our chapter you can find on our website. There's a QR code there, but you could always go to FCCMSE.org for more information on the states we cover and how to become a chapter member. Tonight's lecture will be featuring Rhonda D'Agostino. She's going to be speaking on sustaining wellness for healthcare professionals, not just a pandemic problem. We'll get to the introduction for Rhonda D'Agostino in just a few minutes, but we also want to make sure that everyone knows that tonight's lecture does provide one contact hour. We have physician, nursing, pharmacist, and dietitian CE. There's a link here on the page. There's also a QR code in the top right-hand corner. So I would like everyone to go ahead and snap a picture of that really quick. This survey is due 2 weeks after tonight's lecture. So you need to have this completed in order to get your contact hour by June 24th, 2021. If you have any questions or somehow missed the link, you can email us at communications@fccmse.org. So I'll give you just another few seconds to take a picture of that screen or the QR code to link to the survey. Again, you can email us after the lecture if you have trouble accessing it. You can save the date for our next lecture. Our next quarterly education meeting will be on August 24th, featuring the FCCM current president, Dr. Greg Martin, and he's going to be speaking on the future of critical care. More information will be coming out about that and how to sign up in either your email if you're a chapter member, or you can always follow us on social media, Twitter and Facebook. Also save the date, June 24th, we will have our next student-led critical care Twitter chat. It will be around, let's see, I believe it is at 1 p.m. Central Time. You can follow us on Twitter at FCCMSE or follow the hashtag FCCMSE chat for all of the great discussion that goes on about the journal article for this month, which will be the effect of early balanced crystalloids before ICU admission on sepsis outcomes, the CHEST article published this year in 2021. If you're interested in leading or participating in our journal clubs, our Twitter journal clubs, you can email our social media chair, Caitlin Cundiff, or DM us, direct message us on Twitter at FCCMSE. The Southeastern Critical Care Summit will be held on August 5th and 6th, 2021 this year. You can visit criticalcaresummit.com. I believe registration is now open. So criticalcaresummit.com for more information on how to register for the Southeastern Critical Care Summit. Just a reminder, you can always support the Southeast Chapter by shopping with Amazon Smile, smile.amazon.com, and choose Southeast Chapter of the Society of Critical Care Medicine as your charity. Every purchase you make, Amazon donates a portion of that purchase price to our local chapter. Here's more information about your chapter leadership. Again, you can find more about us in our website at fccmse.org. Just a few of our membership benefits there, and once again, website for more information about how to sign up as a member for our Southeast chapter. We have our bite-sized lecture series is available to chapter members who are looking to gain more regional speaking experience. So if this is something that you're interested in, we would love to talk to you more about presenting a bite-sized lecture series. You can email Susan Smith at uga.edu for more information on that. The concept of our bite-sized lecture is a multi-professional approach. So we like to have at least 3 to 4 different disciplines speaking on one topic. It would be a very quick 15-minute talk from each individual and then time for questions at the end. And so again, if you'd like more information about that, email susansmith@uga.edu.
I just said you were away. I don't know where I'm going.
If you have any ideas for meeting topics and speakers, please give us an email as well. Doug Smith is our programming chair. You can email him at lelandsmithjr@gmail.com. And as always, get all of our important chapter updates by visiting us on social media, Twitter, Facebook, and our website at fccmse.org. So without further ado, I'm going to introduce tonight's speaker. Rhonda D'Agostino is an acute care nurse practitioner with a background in administration and education. She is currently the lead APP at Garnet Health Medical Center and an instructor of nursing at Mount St. Mary College. Prior to her current roles, she was the Director of Advanced Practice and the Associate Medical Director of the Critical Care Center at Memorial Sloan Kettering Cancer Center in New York City. In her previous roles, Ms. D'Agostino expanded the Critical Care Advanced Practice team, developed an advanced practice-led rapid response and sepsis team, and implemented many quality metrics. She spearheaded advanced practice education and directed New York City's first annual Advanced Practice Critical Care Symposium. Ms. D'Agostino was also the recipient of MSKCC's Rudin Award in Nursing for Excellence in Leadership. Ms. D'Agostino is a member of the Society of Critical Care Medicine, where she is the past chair of the Advanced Practice Subcommittee. She is also a member of the Congress Programming Committee, helping to put together the annual Congress content. In recognition of her various contributions, Rhonda D'Agostino was inducted as a fellow in the American College of Critical Care and American College of Chest Physicians. An important aspect of her life is family. Her husband, Paul, is a senior manager of research and development at Siemens Healthcare Diagnostics. Her two daughters, Olivia and Aubrey, and her Bernedoodle, Winnie. She enjoys spending time at home with family, snow skiing, and the beach at Cape May, New Jersey. Thank you so much for being here. We're very excited to hear you lecture on taking care of our healthcare professionals tonight. Very excited to hear it. So without further ado, I'm going to hand it over to Rhonda D'Agostino.
Thank you, Ashley, and welcome everybody. Let me just show my screen. Let me just make sure I have the right one on. Hold on one second. Okay, sorry, I have two different screens, so I got to make sure you guys can all see the correct screen. Okay, you should all see my slideshow now.
I think you may have to click the show button.
Oh, it says show screen.
Yep, there it is.
Oh, you have it now?
Yes, good to go.
Oh, it says it's paused. Show screen is paused. Now it's open. You guys could see it, right? I just want to make sure because.
Yes.
Okay, thank you. Okay, great. So sustaining wellness for healthcare professionals. This is not just a pandemic problem. So I don't have any disclosures or financial relationships. Really, this is for informational purposes only. Please obtain appropriate professional advice regarding the application of this information to your circumstances. Really wanted to today is for everyone to recognize the drivers of burnout and wellness, to recognize sources of stress during a pandemic, and to identify methods to enhance wellness and build, hopefully, resiliency. So how do we define wellness? Is it being focused? Is it holistic health, contentment, or restful? It's really this holistic health. And if anybody knows this man that I have a picture of, he's somebody that I actually enjoy following. His name is Wim Hof. He is known as the Iceman or Iceman Hof. He's a Dutch extreme athlete, and he's noted for his ability to withstand freezing temperatures. He set a Guinness World Record for swimming under ice and prolonged full body contact with snow. And he has these workshops where he brings a bunch of people and have them dive into these extreme cold temperatures, but first training them to focus within their core and to breathe appropriately so that their body can withstand these extreme measures. And he does this all with these wellness techniques. And so he's a pretty impressive guy. If you don't know about him, he's really interesting to look up. He's also had E. coli, active E. coli injected directly into his bloodstream, and of course never got sick, because again, it's really about the inner core and focusing on your wellness and breathing techniques to really relax your inner core. But at the end of the day, you know, wellness is going to look different from, we don't all want to be this person that sits on ice. And so what does wellness look like to you? You know, for me, I've always inspired to be, you know, to look like Chip and Joanna Gaines. And so these are two people that I've followed. Besides their impeccable style, you know, to me, you know, it's amazing that they have this wonderful career, this very large family, this amazing environment where they're living off their farm, and physical and mental health. I don't know them personally, but it seems like they may have it all together. And so it's really important for us to kind of paint that picture of what kind of wellness goals are we trying to achieve. And again, this is going to look different for everybody. But you know, who is it, or what do you want to look like, that somebody that is meeting, you know, all these dimensions of wellness? And so what are these dimensions, and what really is wellness? And yes, it is a state of holistic health. It's a state of being in good health, and it's a state of being actively pursued goal. And that's really important to focus on the last part of that. This is not something that you achieve one day and you forget about the next. This is something that you consistently strive for. The Global Wellness Institute defines wellness as the active pursuit of activities and choices and lifestyles that lead you to a state of holistic health. Okay, wellness is multidimensional, and you know, a number of my slides I'm going to show you either 6 dimensions or 8 dimensions of wellness. But really, all of these different facets of wellness help to become this really holistic, healthy individual. And at one point or another, some of those may be lacking or need improvement over time, and they'll change throughout your life as you work on them. So why are we here in a critical care Southeast chapter giving this talk? Well, again, you know, critical care and working in critical care is not part of the 20 best, you know, work-life balance jobs. In fact, I don't think it's even top 100. You know, working these long hours, we know with a lot of the burnout research that the Society of Critical Care Medicine is now doing, and just, you know, looking at the relationship of professional burnout and safety, and also looking at, I participated in a group that looked at burnout, workforce, and workload. And it's no surprise that perhaps critical care may experience more burnout than other careers, and that this 24/7 on the go dealing with really sick patients may negatively affect providers' well-being. So why is this critical care NP giving a wellness talk? To be honest, I at first don't consider myself a wellness expert. However, when you look it up and you talk about all these wellness coaches and what they do, and it really is a professional who helps people assess their current physical and emotional state and helps them set goals for what they want to achieve. And you know, and as far as achievement in their overall wellness, and helping them to work on their plans and goals. And for whatever reason, I've been kind of this person in many aspects of my life. I constantly, people come to me and call me up and say, what do you think we should do with this? This is what I'm struggling. And maybe it's because I'm always out there putting out that I'm striving for this wellness throughout my life. I'm looking always to lead, you know, and try to meet those dimensions of wellness. And I put, you know, I really talk about my own struggles, where I've had, and I've discussed my highs and lows. In fact, I was asked to give a talk many years ago at Vanderbilt. And at the time, it was about talking about leadership roles as it relates to work-life balance. And a number of years before I gave that talk, I had really hit a low. And then I thought I conquered the ultimate work-life balance, and I had this wellness. And you know, little did I know, we're all just a work in progress. And so I have helped others along my journey. And so I've been asked to constantly give these talks. So here I am. And you know, here's a little dip into some of my struggles and kind of what has set me on this path of being a wellness, and it's hard for me to say expert, but a wellness striver, I guess. So 5 years ago, this is the talk that I gave. I thought I had all the answers. And after the talk, a number of people wanted to either left their job or they came to me afterwards and said, hey, we want you to give this talk again. And I've continued to give certain different versions of this talk. And really it's about, opening yourself up and being vulnerable. And that's honestly what I did. And that I talked about, my struggles. At the time I was very young in my career. I was a working mother. I had 2 young kids at home, and I was struggling. I was struggling to maintain my leadership role, to maintain this booming career that I had, and to also be at home with my kids and my family. And all of that stress, all of this, as it really started to mount and I didn't take care of myself, I started to manifest in having panic attacks. Literally, going to sleep thinking that I was like the worst mother on earth, or maybe that day I had a really bad meeting. I started taking Xanax. I actually resigned from my leadership job that had at that time given me so much pleasure. Went to counseling, was trying to do all these things to try to fix and get back to being happy. And of course, I had listened to numerous books and podcasts and TED Talks and articles, and I've read and read and read and listened to a lot. And so along that way, I've always given people, if you ever need a book to read or about any of these things, there are different books that can help you. I've read a lot. And I overcame my unwellness by some of the techniques I'm going to talk to you guys today. And I stopped having panic attacks and going to counseling. I started having this wonderful restful sleep. I went back to my leadership role and got promoted and took on additional leadership roles. And I was feeling extremely joyful, like I got this, I have this all. I still continue to read because I think, again, we're all just a work in progress. I occasionally consulted with psychics or mediums. And I read and listened to numerous books, podcasts, TED Talks, and articles, along the way, so that I could continue my wellness journey. And so when you come up from this low, you kind of feel this like really amazing. And when I look back and now starting to appreciate these different dimensions of wellness, I now can understand that I was meeting many of these, but not all. I always joked around, even in my talks then, was that I still can't get great sleep. I still can't eat really that healthy or engage in any physical exercise due to my long hours and my commute. But what I didn't realize, and what I didn't want to realize at that time, was my long work hours were impacting my family negatively. And so, it started getting rocky where even with my relationship with my husband not being home, I would reserve all my time with my kids on the weekends, and then I kind of forgot about my husband, right? And so these satisfying relationships over time were starting to become challenging, and I wasn't really putting in the work that I needed to. But again, we can't always meet everything at all the time, and so you just work through these things and you start and you try to do better each day. And the job that I loved the next couple of years later had changed drastically. We were moving into different leadership. We had new leadership come on board. And many of the projects that I was engaged in, that I was actively doing, that gave me so much satisfaction, were slowly being taken away. And over time, I started to really lose that intellect and really getting satisfying challenges at my job, where I came in every day and was just, well, what am I going to do today? And over time, I actually became dissatisfied with my work. And all of this created so much stress because now I was starting to really unfold. And all of this then really, what was already fractured a little bit, started affecting my home relationships. And so I really said, I really need to start changing things, okay? And so really, after 14 years of being at a job that I loved, that I had outstanding evaluations, that I absolutely made a priority in my life, I was asked if I wanted to leave. And so I thought, this is probably a good opportunity. I'm not having the satisfaction that I would, that I had. And I really can't hold on to that past because so many things are changed. And so I left this job that really defined my happiness. And I thought I had hit one of the lowest points of my life. But there was this weird freedom. All of a sudden I had this time to do what I wasn't ever able to do. And then of course the pandemic struck, so it really put a stake in all my plans. And so really this happened to a number of people, not just the one, a lot of people were already experiencing these type of stressors, albeit a little bit differently. But why are we talking about this pandemic? Well, we're in unprecedented time. The COVID pandemic is unique, it's widespread, and unfortunately, it's been long term. New Yorkers, myself being from New York, when we experienced 9/11, it was a day, and then we were able to really heal after that, where we really haven't had a healing time with COVID because it's been so long term. And we know that even with exercise, there's different muscles that we use with a sprint versus a marathon. And so there's different muscles that we need to use now with COVID, being that it's so long, and the psychological footprint is really greatly exceeding the size of our medical footprint. Also, life has been reorganized, whether people are working remotely, loss of job, loss of income, and now you have kids learning remotely. And so there's been different aspects of burnout that we're seeing. We're seeing a lot of overload burnout, and we're also seeing safety burnout. Am I safe enough to come home to my family? Am I safe enough to come home to my loved ones? So we're seeing all those burnout. And it's no surprise that the American Psychological Association put out that nearly 8 in 10 Americans say the coronavirus pandemic is a significant source of stress in their life, and that they have experienced increased stress over the course of the pandemic. Okay. But again, this has not been an existing problem. This has been an existing problem. 63% of parents had already experienced burnout. 40% of that is significant. We are much better at preaching wellness than we're actually practicing wellness, and many of us were already at fault with many dimensions of wellness, and we weren't really achieving them, and we weren't really a happy overall society. And when we look at some of the different trends, even though spending of mental illness has gone up, and this is way before the pandemic, we don't see an improvement in mental illness within the United States. As far as the physical element of wellness, obesity continues to trend up in the United States based on height and weight, or global temperatures, our environment. We're starting to get worried about our increasing global temperatures, and depending where you live with the severe weather. Although we have seen an increase in spirituality, religious has declined, but again, the spiritual element of wellness really has to do with finding that purpose, and whether you do it through religion or spiritual or whatever method, we have seen an improvement with that. Although again, religion and spiritual has gone down. We're also seeing a decline in sperm in Western countries. This has been something that's been declining since the 1970s. And so, overall, we're not a really well society. We don't really have this holistic health. And then COVID hit, right? And so this really stressed all the things that were already fractured. And it's no surprise, again, that this study, again, this is done in Japan. This is looking at all the differences, all the care workers using the Maslow Burnout Inventory. And, with the pandemic, we all saw an increased workload. Most of us were eating an unhealthy diet, decreased sleep, increased drinking of alcohol, and decreased relaxation time, okay? We also saw maybe the financial aspect was really good, even though you're working hard. We then saw a lot of different finances affecting different people. And so the Stress in America 2020 puts out this yearly report, and they go through different things that are affecting America within that year. And for 2020, they basically said we are facing a national mental health crisis that could yield serious health consequences and social consequences for years to come. So what do we have to do? Well, we can't do what we were doing before. We all talk about going to pre-pandemic, but that we weren't, majority of us were not healthy. So we really should not think about going back to what we were, and recognizing that we need to start changing our culture for the better, okay? And the first thing that we need to start with is really recognizing the patterns of stress, okay? We all experience stress in different ways, whether it's physical, aches and pains, headaches, stomach and digestive problems, versus sleep disturbances, low energy, depression, mood changes, always coming to say the glass is half full type of picture. And, again, stress can manifest in many different ways for many different people. We all know that one person possibly that's at work or in your home life that they're just nasty. They're just miserable. Anything that you try to talk to them, they're just nasty. And you don't look at them and say, oh, what did I do to make them? You look at them and you say, they're not happy, right? And so it's really, and it's important for us to recognize when we're not happy. Unfortunately, that individual doesn't recognize that and thinks everybody else is the problem. So we don't want to be that person. We want to be able to recognize our patterns of stress and really prevent them from either getting worse. Same thing for burnout. This is, always ask yourself, are you becoming cynical, critical at work, or do you drag yourself to work or have trouble getting started? Have you become irritable or impatient? Do you lack the energy to be consistently productive? Do you find it hard to concentrate? Really go down these list of questions and always check in with yourself. When things are not right, check in with yourself and continually ask yourself these questions. Because burnout really is this syndrome of emotional exhaustion, depersonalization of others, and a feeling of reduced personal accomplishment. It's not the same stress. You can't cure it by taking an extended vacation. In fact, I was just talking to one of my friends today saying, you know what, I'm feeling a little stressed. Like I can't get my thoughts, organized, and I know I need a vacation. Like I just need a vacation. It's been a number of months. I need to go on vacation. But burnout is not like that. You can't slow down or work fewer hours. Stress is one thing. Burnout is totally different state of mind. And under stress, you still struggle to cope with pressures. But once burnout takes hold, you're out of gas. You've given up all hope. Okay, and you have all these surmounting obstacles now. And all of this is about really starting to know yourself. And understanding your core personality, whether you take a self-assessment, but constantly to check in, like, who is this, who I am? And unfortunately, some of us finally realize who we are, not until our late 40s. We say, oh, now that I'm in my 40s, or my 50s, we usually learn this much later in life. But start to appreciate, what defines you. If you think about 5 traits that define you, write them down. These are what define me. These are 5 words others would choose to define me. This is the role I play with friends, and this all helps you to get to know your core values. What is your overall values? What is your vision? What is your mission? These really get to know deep down, what do you want? What does stress look like for you? So that you can identify these things, okay? And again, you constantly have to check in with yourself, understanding what makes you stress, what relieves your stress. And then when things are not normal, for example, when I was undergoing stress with the new leadership changes, I was waking up and I'm like, I don't want to go to work today. I had never felt like that in 14 years that I had been there. And I was really struggling to go into work. And I started saying to myself, Rhonda, why are you like this? And I was realizing that all these things that gave me happiness at work were no longer there or able to provide that. And so by constantly engaging in self-reflection, you then say, all right, now I see why I'm so stressed. Now I see why I might have lashed out. And then once you start to identify okay, I'm under stress. Now it's time for action. Now it's time to say, okay, I need to start performing these stress relieving techniques, okay? And we're gonna go over those. So when I say know thyself, this refers to what dimension of wellness? Is it mental, emotional, social, and spiritual? It's really the emotional dimension of wellness, looking at emotional intelligence, knowing yourself, knowing how to interact with others, building these relationships. And sometimes, I love this saying, you need to step outside, get some air, and remind yourself of who you are and where you want to be. And a lot of times, these things will change as different things have occurred in your life. And so really reorienting yourself to that is really key. This was a slide that I also gave back in 2016. And at that time I had broken up into work and life. And I said, I'm happy when I'm working. I'm happy when I'm in a leadership role, solving big organizational issues and taking care of my employees and my patients. And I'm happy when I'm home with my family. And I had even, further broke that down and said, okay, if I could be home with my family for 4 nights for dinner, you know, that's my goal. I feel a strong connection with my daughters, and maybe this is why I started having issues with my marriage, because my daughters were my priority. I travel, I feel healthy, and I exercise. You know, those were my priorities that, you know, again, it was really difficult for me to exercise with my long work hours. But I identified this is what makes me happy, and I identified this is what I could do about it. And so it's really important for all of you, if this is, you know, part of your journey, is to really sit down, whether you break it up for, via work or life, or break it up of in other aspects, but just writing things down, like, this is what makes me happy. And your list could be, you know, 2 things, and your list could be 20 things. It's just important for you to identify those things, okay? And now I've re-looked at these, and I'm like, well, so much has changed in my life now, and I'm really happy when I put my home life first. And that really has been a big change. And so I'm home with my family now. I have a strong connection with my daughters and my husband. I travel, and now I've even engaged in really healthy and eating and exercise. Of course, I had to join CrossFit because it's really strenuous and challenging. And so I now go to CrossFit 4 or 5 times per week. And really, I thought I could never not be in a leadership position, but I've realized now I just need a purpose. Whether, you know, a purpose is to be a professor at the college I teach at. This is where I have control over certain things. I could build programs, which I'm involved with right now, and that's really important for me to be challenged. I know that I need to be challenged, so having this amazing dean that I work with, we're, you know, starting to build a lot more programs, so it's really engaging, and I feel very involved and engaged in this meaningful work. And then I start to see my students grow, and so that has given me so much more happiness. And it's just, again, it's taking, you know, these life challenges that are thrown at you and saying, I could still achieve these things, even though the situation is different. And then once you start to really understand who you are, and what you want, you can then really start to narrow and focus on these dimensions of wellness. You can't do this without knowing who you are, though. And this is a process, right? I didn't know from day one this is what I wanted. I did these things that I talk about. I sat down, I wrote my goals out. Just the other day, I wrote my goals because I wanted to look at more future. I'm doing this now, but where do I see myself in 10 to 20 years when my kids leave and go off to college? That's another huge change that I'll have to deal with, right? But everybody's different, so it's really important for you to identify these things, and I unfortunately cannot do that for you. So we have to prioritize our self-care, okay? We need to start practicing what we preach. And in some ways, COVID has kind of helped us do that a little bit. We were kind of pushed into this chaos. So it's important to really focus on our physical well-being. And what does that look like to you, right? Not everybody needs to have, you know, be buff and going to the gym, but just you have to engage in some sort of appropriate exercise. You need sleep. Okay, these are things that you just can't really live a holistic, healthy life without doing. And it's really important to eat healthy. And then if you have any illnesses like hypertension or diabetes, you know, it's important to get these under control. Okay. And then as far as environmental, what environment do you thrive in? You know, for the 14 years that I commuted to New York City, I commuted an hour and a half. And everybody used to come to me like, I don't know how you do it. I don't know how you do it. But for me, I did live in New York City, and it really was not the place for me. It's not the place that I was able to really thrive in. I hated the noise. I hated the congestion. I needed to come back to a place and really wanted to raise my family in a place that didn't have the noise. I built a house on 9 acres because that was and environmental wellness is very important to me. I do better when I'm in open spaces, and I know all this because I have tried to live in much smaller spaces. Unfortunately, that led to the challenge of a longer commute, and again, you have to balance all these things out over time. And it affected, you know, my physical being because again, you know, it was hard for me to put in time to exercise. But every day I came home, I walked in the door and it was this relief for me, and it was this environment in which I felt relaxed in. So you have to define what that looks like to you, okay? And then social, what are you doing to support the relationships? The relationships are not where you just sit back and it's just, I mean, you have some of those that are easy and God bless those, but really, what are you doing to support? And this is not just about family or marriage, this is about the relationships that you build at work, the relationships you build elsewhere. And then, of course, you know, if you are married or have kids, it's really looking at your marriage and what you're doing to support that. You know, for me, I never prioritized my time with my husband. It was always about my kids. And now we take a year of vacation every year without our kids and have date nights. And then again, you know, what are you doing to support healthy relationships with your kids, your family members, or your friends? Okay, so start thinking a little bit about that. As we do this, and as we start to build awareness, we actually start to build resilience, okay? And this is really slowing down and thinking. This is not going right to the react snaps. This is about slowing down and thinking and saying, all right, this is when I am, this is when I know the signs of stress and mental exhaustion and burnout, and really start to, you know, take those challenges that you have and understand them. For me, coming and working from home and now taking care of my kids on a full-time basis and dealing with schoolwork because of the pandemic, that was a huge challenge, which I very easily became very frustrated with. I said my dog is going to be back. There she is. And so it's really important when you start to do this, as I realized that was a stressor for me. I'm going to sit down with my kids now. Why is this a stressor for me? I then realized that once I started doing that, helping them, seeing them in their challenges and helping to overcome their challenges was really important to me. I felt more connected with them, and I started to realize, like, wow, there's so much I was able to participate in because, again, I was working so many hours during the week. And so after I learned to take that challenge and really say, wow, I feel better, and I feel I'm a better mother when I actually teach my kids and start to turn that into a positive. So it's really important that you take these obstacles, you start knowing the signs of stress, and you start kind of organizing them in your head and just really slow down and think about them. All right, another question. Some of the disadvantages of resilience are all the following except. So reduce authenticity, increase stress, lower serotonin levels, and D, higher serotonin levels. So it's really, when we build resilience, we actually increase our authenticity, we decrease our stress, and we have higher serotonin levels. So it's all they following except is D. So actually it's really important for us to build resiliency, okay? And there's different approaches of how to do it, whether it's mental toughness or a mindfulness approach. The mental toughness is more used in sports and military. If you vision it, you could do it. It's this positivity approach. It's great for competition. And it really relies on our adrenaline and our cortisol. The problem is that over time, it may reduce authenticity and increase stress if your goal is not achieved. But again, knowing yourself and saying, okay, if I don't get it this time, it's okay. And then the mindfulness approach is a more compassionate approach. It's really about achieving this inner peace and really setting these mini goals. And over time, this is going to release dopamine, oxytocin, and serotonin. And so these mini challenges then excite you. And so you start to develop social bonding and trust. And really, when we learn how to become resilient, we learn how to embrace beautifully the broad spectrum of the human experience. And that's really what it is, because life is not perfect, right? You're going to get thrown all these different challenges, and how we react to them is really most important. And really the capacity to recover quickly from difficulties is all based on resiliency. Another thing I want to talk about is being drawn versus being driven. I now realize that early in my career, I was so driven. The problem with being so driven is that unfortunately you don't always see the water that you're swimming in is rising. You're constantly on the go. I got to get that promotion. I got to work harder. I have to do OT to help my colleagues. And we saw a lot of this drive also during the pandemic, where we're all like, we're going to do this. And it's fine for short periods of time where you could be on autopilot, but for a long time, it's not good. And if you ever find yourself consistently saying to yourself when you go to sleep at night, oh, there's just not enough hours in the day, oh, I can't meet these deadlines, you're constantly feeling under pressure. I used to be able to check all 3 of those plus 5 more. This is really where you're taking your drive into where you're going to get emotionally exhausted and then become stressed and burned out. Whereas drawn is you could still want those challenges and you could still pursue these goals, but you're accepting that there's going to be pitfalls and you're in charge. And you're really anchored in the present moment. And I can't talk enough about being anchored and being present, because many times I would talk and have conversations with my mother and she's like, I'm talking to you, but your mind is somewhere else. And that used to bother me because you should be present for these relationships. And it's really important as you go through these that self-talk, you're talking to yourself in this compassionate, supportive way, and that you don't always have to meet these deadlines, or don't set the deadline so strict for yourself. A lot of times we do this to our own selves. So really be careful being too driven. And really start practicing being drawn techniques, which are taking just 5 minutes. 5 minutes, it seems so long, but it's really not. And just sitting down and just having, thinking about the day, thinking about what is great about this day, what are going to be some challenges, just taking these breaks. And maybe I did this a lot during our pandemic. The hospital I work at has this beautiful outside garden, and just taking a walk in this garden, and it has this like bridge over water and a koi pond. It's really beautiful. It was amazing to do this. Constantly, you are your own worst enemy at times, and it's really important for you to constantly say, you did a good job today. Yes, there were challenges, but overall, you tried your best. I really believe in grounding techniques. This is another thing that I did during COVID, or when my stress level is so high, is, come home, or if you're home, take off your shoes and just go outside and put your feet to the ground and stand on the grass, not concrete, grass. And it's really important when you ground yourself. There's a lot of energy that's there that helps you really to slow down and breathe. And then if you're in leadership roles or you have lots of meetings, it's important to really put some cushions in between those meetings. Scheduling and being organized with your schedule really can help you along in the long run. Okay. When there's times where you're really stressed, okay, there are some breathing exercises. Again, this is why I love Wim Hof, because he's going to put himself under this intense stress of these severely cold temperatures, and it's all about breathing techniques. And this is shown to reduce the stress response and stimulate the vagus nerve. And one of the techniques is a belly breathing exercise. You could do this while you're sitting or you're lying. And this is where you close your eyes. You place one hand on your belly and one hand on, which is just under your ribs, and another hand over your heart. And you deep breathe through your nose, out through your mouth 3 times. And it's so important to do this. And sometimes you're like, well, do I really need to do this? Because I used to say myself that as well. But it's really important, especially, I found myself doing this on breaks during COVID. There's also the 4-7-8 breathing. This is a yogic practice of breathing. It's a little bit more focused than the belly breathing. You inhale, you count to 4, you hold, count to 7, and then you exhale and count to 8, and you keep doing that, okay? And a lot of this does help over time, and again, these techniques start to really build resilience. We're starting to see now also during COVID, a lot of organizations take part in this culture transformation. I actually saw a talk, and I'm borrowing a slide or the talk from North Shore Hospitals. This is a hospital system out in Long Island, and they have an entire wellness coalition that's led by a wellness physician, and they really talk about all these different facets, what the organization can do to support wellness, looking at training leadership, looking at change agents, actually wellness supporters that go around in the organization. And so the whole organization is now creating this well-being culture. I was talking to also my colleague at Sloan, and she was telling me some of the things that, and she was like how I used to be, where she's, having meetings after meetings and always working, and she now gets these emails, these well-being analytics. that talks about how many quiet days, and of course, you know, she hasn't had any quiet days. And looking at her 4-week trend, and again, looking at quiet days where she's not engaged on email or meetings, or and then there's also chats, but really hers is emails. You know, she's the type of person I could email at 2 o'clock in the morning and will respond. And I keep telling her, you can't keep this up. You can't keep this up. But it's really, I mean, this is, I think, a great thing that the organizations are doing now to give you these analytics, right? If we're in the know, we could really start improving. And not having any quiet time is not good. Okay. So, what has the greatest effect on your overall wellness? Is it A, accountability for your own well-being, B, building coalitions, C, workplace-sponsored wellness programs, or D, physical activity? And hopefully by now you're realizing it's A. It's really accountability for your own wellness. As much as organizations are putting out these things, you could take that information and do nothing. It's really being accountable for your own well-beingness. So I want everyone to start today. I want you to write down your mission. Like, what is your mission? We work in organizations that have missions, but what are your aims and values? Write down your vision. What does your future position look like? And not position within an organization, but position in life. What does that look like to you? And you know, write down things in your life that are helping you accomplish your happiness or your mission and vision. Write down things in life that are impeding your happiness. And you know, identify which dimensions of wellness you're exceeding and which ones need work. You know, these will change over time. You know, my mission had completely changed within the last 5 years. And so really looking at your inner self, knowing your core values, and knowing that they do change, and really constantly reassessing where you are. And you don't have to do this every day, but you know, once a year, once every 2 years, 5 years, you know, sitting down and saying, okay, do I still have these mission and visions? It's really important. At the end of the day, while we maybe all can't be like Chip and Joanna Gaines, or maybe we don't want to be, we may not achieve every single dimension of wellness, but we could be darn good at being a work in progress. These are some of my, again, I just kind of scraped the top of my books and TED Talks that I had read that just really inspired me throughout the years. Of course, there are many others. I hope you guys all continue to engage in your own wellness. I hope you all are safe and happy and healthy and continue to lead that life. And I guess I'll leave it up now for questions.
Wow, thank you so much. This was an amazing talk. Thank you. If you guys have any questions, please feel free to share them in the questions chat box. Let's see. I have a couple of comments. Oh, I'm not sure where these were in the timing of the presentation, but Leslie Hamilton says yes, and Sherry Bariel says sounds like me and way to go. So just some really good positive affirmations there.
Thank you. Yeah.
So while we're waiting to see if anyone else has questions, I have a quick question. So, you know, you said and you spoke a lot about, you know, making sure that you're taking care of your individual, I guess, sort of responsibility for your own wellness. And of course, companies have a lot of things that they're doing these days for you, but definitely a lot of things we can do on our own for ourselves. But, you know, many of us also work in teams. And work with groups. So do you have any thoughts or recommendations for ways we can improve our group wellness, so to speak?
That's a really good question. And I've addressed this. I think I gave a talk maybe last year or 2 years ago about what leadership could do. I think one is just to be present. And I know it's been hard during COVID. I mean, but just engaged, you know, knowing what your team is going through. You know, some of us, you know, I think it's really important for us to appreciate the different personalities and aspects of each person as part of that team. I used to always joke to say my team we would never be friends on the outside, but yet each of us brings this amazing skill set that makes this team so much better as a whole than as an individual. And so really focusing on those positive aspects. And that's a lot of times what I did when I had these team meetings. Really, I think it's important to do check-ins quite frequently. And not just like, hey, how's it going? And then as you're passing the hallway, but really sit down and have those check-ins. Those things do take time. I always found one of the silliest things during COVID, we were running around with all of our heads cut off pretty much, and we had leadership just bring us bottles of water. And I couldn't be happy. I thought this was like the most genius thing, because for me, it's like, I can't even get enough water. I haven't had a break. Just to have that bottle of water and say, here's a bottle of water. I mean, that was like, just for me, I was like, thank you so much.
That always have
These little things I think are important.
Sure. Yeah. Do you have good questions? You said, don't just ask, how are you doing? Do you have any good questions that you'd like to use?
Yeah, well, for me, it's about the individual, right? So you have to get to know your team. And for me, and that does take time. So, right off the get-go, no. But once you start to get to know your team, for example, I had somebody that was dealing with a kid that wasn't doing well in college. Knowing what they're coming to work with that stress of the kid's not doing good in college. And so I think their kid had to go for some test, and just remembering the next day, hey, how did everything go? Employees will remember those things, and just engaging on that personal level, I think, is really important. It's not something you should do all the time, and some maybe more, but if they're willing to open up, I think it's important for you to remember those conversations, and then check in with them so that that they remember that they're just they're a person, and not just your worker or your teammate.
Yeah. Let's see, Ruth Kleinpel. Hi, Ruth. She has a question. What are strategies to promote a healthy work environment at work? I think we've touched a little bit on that, but I love this part of her question. And then how do we engage others in that process?
Oh, Ruth always has great questions.
Yeah.
So what I have found with COVID, and again, I think everyone's going to have it differently, was taking that time where you're not in the war of things. So taking, we have number of work rooms. So we had one work room which was right in the action, and then we have another work room that was like down the hall. And it's easy just to go. I normally stay in the regular work room that's right there, so that there's no breaks, right? There's, oh, hey, you're here, can you do this? Or hey, it's important to take just, whether it's 5 or 10 minutes, go into where you could have just some, I think, quietness, where there's not a lot of going on. I think that's important. I think if setting time and bringing, not relying, for us, it was really nice. The families would bring in all this food, but you started to really eat unhealthy. I mean, we know a number of people, including myself, that gain weight because here's donuts and here's pizza, but that didn't make us any better. It didn't feel good at the end of the day. I went home saying, oh my God, I can't believe how much I ate. So maybe preparing yourself for the workplace that day, what healthy foods and snacks are going to keep me energized. Those things I think are really important. So yeah.
I love that. I think, like you said, is just being there and being present keeps your team engaged for sure. They feel like you're supporting. Let's see, Doug Smith. Hey, Doug. Doug has a question. First, he says, thank you so much for sharing and your vulnerability. Any tips or phrases for setting boundaries with your boss when they ask you to do something you don't have bandwidth to do, but you don't want to seem like you're not a team player? No, sometimes might give your boss a bad taste about you. I think that's a great question about how to professionally set boundaries.
Yeah, this one I'm not good with. I'm gonna be honest, because I told my dean this summer, I said, I'm not gonna get into this where I'm taking we don't have, as a professor, I don't have to teach in the summertime. And I said, I'm not gonna take all this extra work. But of course, my dean comes to me, can you just teach this one class? Okay, I'll teach this one class. You know, I want to show her I'm new there. I want to show her. I'm now up to 17 credits, and I'm like, how did I get here? So I feel your pain, Doug, because I am not good with this. But I think it's all a little bit of, you know, again, one of my books, Give and Take by Adam Grant. I love this book. You know, again, the givers do get more. You could, he really talks about the people that have the giving personality. And I think at first it's okay to give. It's okay. Sometimes you do give and you're like, okay. But then once you do, I think that's the time to set the boundaries. Like, hey, I'm going to teach all this for you because you need a summer, but next summer I can't do this. And they're like, no problem. Thank you so much for doing this. So again, my recommendation is the book Give and Take, because it talks about this. It talks about the overgivers. The overgivers are really low on organizational charts because they're very miserable. So where to find that balance? And that is a book I'd highly recommend if you do struggle with this. And again, we're all works in progress. I've obviously, but I was new to the teaching to the college, and I wanted to show that, you know, I'm a team player. But next year, not gonna what I can't do 17 credits again.
Yeah. Great. And then I think we have one more question, and we'll make this our last question from Lisa Hayes. Lisa says, thank you so much for your thoughts and resources. Any best practice suggestions for a work schedule of 7 on, 7 off? How to balance need to do things on off week since the whole team is never at work at the same time?
Oh, so I don't know if you're gonna like my answer. Sometimes I give a very straight answer. I think the 7 on, 7 off work schedule is extremely unhealthy. And that's from somebody that actually does nights. I believe that it's really difficult to set some type of organization within your schedule, to set those plans that you need to do. You know, I've had job opportunities which had presented those, and I declined them because those seem to be very difficult. I know, you know, within my organization at the hospital, there are our physicians work 7 on, 7 off. I could tell you by Sunday, even Saturday, they are not present. They are so burnt from working those long hours and in a long span of time. So I'm pretty short on recommendations, but I think, you know, everything you have to adjust with. And I'd go back to, what are your core values? Like, you know, having those 7 days off, are you still able to accomplish what you can accomplish? You know, it's hard. But again, going back to self-reflection, does this work for you? You know, for me, it couldn't, because I just don't have the set of resources to do those things. But
Right.
Again, it may work for you, and it's just planning out your schedule if you can ahead of time, and setting what your goals are for your off weeks, and making sure you have enough respite during those times, which is hard.
It almost sounds like just because we've always done it this way doesn't mean we have to continue doing it this way.
Exactly.
Opportunity to readdress how we're doing things. Yeah, great. Thank you again so much for joining us this evening. Thank you to all the attendees. I've popped the CE instructions back here on the screen again. If you guys need to take a picture of the QR code, it's there, and that'll get you to the survey link. Or if you want to use the very long and difficult website address there as well, it's there. We'll leave that up for just a few more minutes. But again, thank you all for joining us, and look for our next event coming up in August. Thank you.
Great. Thank you.
Bye.
Bye-bye.